Back again. We're back again. I want to invite the next presenter, and he will take us through the topic, how routes of drug administration affect drug level in the body. So without wasting time, with a round of applause, let us welcome the next presenter. Thank you. You're welcome.
Thank you, sir. All right, good morning. Starting on the existing protocol regards to the lecturer and the student. So basically, I'll be talking about how routes of drug administration affect the drug level in the body. So I'll be starting by introducing to us that this is basically pharmacokinetics, and it describes how the drug moves through the body, encompassing the absorption, the distribution, the metabolism, and the excretion that is fondly called ADME by acronym. This route of administration is a fundamental factor that influences the processes, and then it determines the speed, the extent, and efficiency of drug delivery in the systemic circulation and target tissues. So there are different routes of drug administration, and then they offer different levels of drug in the body depending on the route by which you follow to administer your drug. So it has a direct link on how the drug will be much present in your body, which is the level of the drug. So I'm going to be giving us a fundamental view of all these routes of drug administrations. We have the oral route, we have the intravenous route, we have the intramuscular subcutaneous route of drug administration, we have the transdermal route, we have the inhalation, and many more. So talking about oral route is very common and widely used, and in fact the most convenient route of drug administration. And in this case, the drug is taken orally, and then it is absorbed primarily in the stomach and then the small intestine. So absorption speed and extent depends on factors like the gastrointestinal pH, the motility, the food presence in oral route of drug administration. And then for the intravenous route of drug administration, this route enables the delivery of drug directly into the bloodstream, and this does bypass absorption's barriers. This route achieves 100% bioavailability, which is a very important factor when talking about intravenous route of drug administration. And then this intravenous route of drug administration is very ideal for emergency cases or drugs that require precise dosing, such as antibiotics like vancomycin. But then this intravenous route of drug administration requires a very sterile condition, and then it is meant to be handled by professionals, right? Because some other persons can just take drug and administer by themselves, but I bet you cannot inject yourself intravenously. So that is why intravenous route of drug administration is handled by professionals. Also, we have the intramuscular and then the subcutaneous route of drug administration, which involves injecting drugs into muscles and under the skin, respectively. I'm talking about intramuscular and then subcutaneous. So for the intramuscular, the drug is injected into the muscle, while for the subcutaneous, it is injected directly under the skin. And then the intramuscular is typically faster due to greater blood flow in the muscles. We have the transdermal administration, inhalation administration, which is also very common, where the drug is administered directly into the lungs. And this offers a rapid absorption rate due to the large surface area, and then the rich blood supply that is very much present in the lungs. So this route, I'm talking about the inhalation route, is commonly for respiratory drugs like albuterol, salmeterol, and then this does achieve high local concentration with minimal systemic effect, unlike the intravenous route of drug administration. So these are the key factors that influence drug absorption. Apart from the fact that we have expressly talked about the roots of drug administration, we now have the key factors that influence this drug absorption depending on the route. Number one factor is the physicochemical properties of the drug. We have the dosage form and formulation of the drug itself. We have the gastrointestinal factors, like I mentioned the other time. There can be pH, surface area, gastric emptying, and motility, the GIT motility. We have the blood flow to the absorption site. It also affects the absorption rates of the drug. It does influence it greatly. We have first pass metabolism. We have patient specific factors. These are different factors. In fact, we have drug interactions. These are different factors that affect the absorption of drugs. So I'm just going to run through them one after the other. The physicochemical properties of the drug. I'm talking about the molecular size. I'm talking about the ionization state, the solubility property of the drug. These are the physicochemical properties that can definitely affect the drug. A drug of a pea size will definitely get broken down and get absorbed faster than a drug that is, of course, significantly bigger than a pea. So we have the solubility. The dissolution rate of different drugs also affects their absorption level or absorption rate. There are some drugs that takes longer time before they get dissolved, even after oral administration. They take longer time before they get dissolved, while there are some that have very short dissolution time, and this can be most of the time depending on the excipients used in the formulation of these drugs. So we have the dosage form and drug formulation itself. I've talked about the disintegration and dissolution, and excipients that are being used also take a role in the absorption rates of any drug. Talking about the gastrointestinal factor, which is a very, very important one, the pH of the GI tract does affect the absorption rate. The surface area, the kind of food you have taken. Some drugs do very well, they thrive very well absorption wise when they are being administered with oily food, while some will not thrive in such environments. So the food intake also enhances. Some high fat meals, they are very good for lipophilic drugs. Alright, so we have the blood flow to the absorption site, as I've rightly said before. For inhalation route now, the administration of, for example, salmeterol through the nasal cavity makes absorption of salmeterol very much, broad in the lungs. We have patient-specific factors. These patient-specific factors can, in fact, be from the different demographics. We have the age, the condition itself, the disease, and then the genetic factor, which is, of course, very, very differential for different persons. So we have drug interaction. Sometimes when you co-administer drugs, they interact and delay each other in absorption wise. So I'm going to be giving a comprehensive analysis of drug administration routes and how they affect the level of the particular drug being taken in the system. Talking about the oral route, the bioavailability and its role in drug levels. Bioavailability basically refers to the fraction of an administered drug that reaches systemic circulation in its active form. For orally administered drugs, bioavailability is often less than 100% due to incomplete absorption and first pass metabolism. Definitely, when drugs are taken orally, their bioavailability is not optimum. I mean, you don't achieve 100% bioavailability for orally administered medications because of certain factors, which is number one, first pass metabolism, and then also there can be motility, intestinal motility factor, physical chemical properties such as the solubility and stability of the drug in the acidic environment of the stomach. So we have gastrointestinal factors affecting drug absorption that are being taken orally. The GI tract presents a complex environment that influences drug absorption and subsequently systemic drug level. Key factor includes, as I mentioned, the pH, the surface area, and the transit time, which is the motility. The stomach has an acidic pH of about 1.5 to 3.5, which can, of course, degrade the acid-labeled drugs like penicillin, for example. And then when this happens, it reduces their bioavailability. Apart from the fact that it's subjected to first-pass metabolism effect, the acidic content of the stomach can also, degrade the drug, and it does reduce its bioavailability. In contrast, the small intestine with a neutral pH of 6 to 7.5 and large surface area due to the villi and microvilli in the primary site of drug absorption. Drugs that are weak bases such as morphine are better absorbed in the small intestine due to the favorable pH condition for them. So another factor that I've rightly mentioned is the drug formulation and delivery system. The formulation of an oral drug significantly impacts its absorption. Yes, the form at which a drug is being produced does have a direct link to its absorption and systemic levels. Of course, immediate release formulation dissolves quickly in the GI tract, leading to rapid absorption and higher peak plasma concentration. In contrast, extended release, like we have the SR, like the diclofenac, they take a longer time for them to disintegrate and get, totally made use of by the system. So we have as well inter-individual variability. We all know that in as much as we are all human, we have different variability, and that also does affect the level of drug absorption. So inter-individual variability in drug response is another critical factor affecting systemic drug levels after oral administration. Yeah, so all of what I've mentioned right now are those specific things that makes the drug level through oral route reduced or increased. So we have again the bioavailability, the gastrointestinal factor, the drug formulation itself, and the method of delivery, and then we have the inter-individual variability. So now I'm going to be moving to the intravenous route of drug administration and how it affects the level of drug in the system. So the bioavailability, in contrary to the oral route of drug administration that was declared not to be 100, the bioavailability of drug through the intravenous route of drug administration is most times 100 because the drug bypasses the gastrointestinal tract and liver metabolism before entering the systemic circle. So another factor is the pharmacokinetic concentration. The pharmacokinetic of intravenous routes administered drugs are primarily governed by distribution. There is no need for the motility in the GI, the breaking down, the dissolution, and all of those things. It's just straight, direct to the point distribution. As we all know, even through the oral route, it will still get absorbed into the bloodstream and get distributed. But in the intravenous route, we are bypassing all of those levels and then we are moving straight to distribution. And there are clinical advantages and challenges in intravenous route. The IV route offers several clinical advantages, including rapid onset, as I rightly mentioned before, precise dosing, and the availability to administer drugs that are poorly absorbed or that are very much unstable in the GI tract, such as monoclonal antibodies or certain chemotherapeutic agents. All right, so right after that, I'm going to be talking about the intramuscular routes of drug administration as well, and then how it does affect the level of drug in the body. This route delivers a drug into the muscle tissue, typically in sites such as the deltoid or the gluteus muscles, which are rich in blood supply. Yeah, definitely. In the muscles, we have volumes of blood there, right? So the drug is absorbed through the capillary network within the muscle into the systemic circulation, bypassing again the gastrointestinal tract and the first pass metabolism in the liver. The IM, the intramuscular route, is also particularly useful for drugs that require sustained release or cannot be administered orally due to their instability. Some drugs are very much unstable or not stable, so going through the oral route might cause them not to be much more active anymore. So we subject them through the intramuscular routes. So the factors influencing absorption and drug level in the intramuscular route are of several forms. The injection site is a critical determinant as muscles vary in blood flow and tissue composition. The deltoid muscle, which is high in vascularity, promotes faster absorption compared to the gluteal muscle, which has more adipose tissue. That can slow drug release. For instance, intramuscular injection of diazepam in the gluteal muscle may result in delayed absorption due to the fat deposition, leading to lower peak plasma level. So now for the intramuscular route of drug administration, we have rightly said. So we're going to be moving to the clinical implications of route of drug administration on drug level in the body. The clinical implication, what we are expected to see clinical wise. So for the oral route, the oral route is preferred for chronic condition due to its ease of use and patient compliance. So these are the reasons why in clinical practice, practitioners choose which routes of drug they are going to use or choose for easy drug use and all. We employ the use of oral route of drug administration. But for precise dosing and perfect 100% bioavailability, intravenous route is just the very best. And for drugs that are maybe not stable, they are formulated to be injected through the muscles. And then we have the buccal and sublingual route as well. They also foster fast administration and absorption of drug because they are capillaries that picks them up and delivers them straight into the systemic circulation. So by comparison, if we have to say by comparison, which is very, very important, we are going to make it as intravenous route of drug administration is very much higher to give you the level of drug that you want, especially as I have stated earlier that most of the time gives us 100%, unlike the oral route of drug administration that delivers less than that due to the first pass metabolism effect of the liver and some other gastrointestinal factors. So that is it. Thank you so much.
Wow, thank you very much for this. Thank you for the presentation. Yes, that was a wonderful presentation. How route of drug administration affect the level of drug in the body. Yes, because it's how it enters the system has a lot to do with the amount that will be in the system. He pointed them out. He talked about the intravenous, why it has 100% bioavailability, and talks about, in fact, he arranged them based on their bioavailability. From after the intravenous, he went down to intramuscular, subcutaneous, and the different routes of drug administration, and they actually affect And what I am happy about is that he pointed out something, how it will determine the route of administration for a particular patient. He made mention of chronic, for patients with chronic issues, talking about the oral administration, because for chronic you are not running to anywhere. You're not running to anywhere, so you are there. So and you need to be consistent with what you are doing. Apart from other factors that may affect route of drug administration, apart from other factors, it's very important to understand this. So without wasting time, because let me not start a new presentation on the topic. He did justice to that. Thank you very much for the presentation. Please, another round of applause, please. And for our viewers, please, if you have any question, feel free to drop it in on this comment section. And if you have any suggestion, any recommendation, feel free. And God will bless you as you do so. Don't even think of leaving, because we are coming back with another topic. See you next time. God bless you.